consultant. Today, it's another question-answer day. Isa sa aking mga subscriber asking question about the problem with her breastfeeding. So today, isi-share ko sa inyo kung ano yung mga solusyon sa breastfeeding problem natin ngayon na isi-solve natin, okay? So, this mom has been struggling with breastfeeding for more than 3 weeks now, okay? She started with good, na nakapag-latch siya after 3 days, 4 days after she gave birth. But suddenly, yung behavior ni baby nagbago. Nangyari kasi, the baby was feeling very sleepy during the past 10 days after she gave birth. Dahil yung baby, it turned jaundice, meaning naninilaw. So normally, sa mga Asian babies, based on our study, Asian babies are prone to getting jaundice. Nasa dugo ng mga Asian yan. So, nangyayari ang jaundice, sometimes it can happen 3 or 5 days after birth or even longer. Nangyayari ang jaundice dahil minsan kulang na kulang ang baby ng intake, meaning intake of milk, kaya naninilaw si baby. Kaya nagiging worse ang jaundice. Minsan ang jaundice will go away after a week, after 10 days. Minsan then it can last weeks, even months. So ang jaundice, pag very high yung level, nagiging sleepy and sleepy si baby. So the tendency is when the baby gets sleepy, the breastfeeding become lesser dahil walang initiative si baby na mag-latch. Laging feeling fatigue, feeling tired, walang interest to latch. So ang nangyayari dito sa incidents na to, si mom tuloy kulang na kulang yung time niya mag-breastfeed dahil every time she breastfeed, the baby will just fall asleep. 3 minutes, 5 minutes, the baby fall asleep. Kaya ang nangyari, she got so engorged for first week and then bumagal na yung gatas niya. Because again, with less stimulation here, kung wala siyang pumping, the milk would really go down. So ang problema ngayon ni mom on how to train this baby to latch again after treatment of jaundice dahil ang nangyari na readmit yung baby sa hospital because the level of jaundice was very high. In our case here, during my nursing career, pag ang level ng jaundice dito is about 12.5, medyo concerning na yan. Okay, I don't know kung anong policy dyan sa Philippines when it comes to level of jaundice. Ang ginagawa namin ngayon pag 12 or 13, inoobserbahan namin yan of how the baby is pooping. Pag after a day, the level is 12.5, the baby is pooping maybe every 3 or 4 hours. So we observe that. Pag si baby no pooping for like a day and then jaundice level is 12.5, for sure, the next day, probably aabot ng 15 yan pag hindi nagpo-poop. But if the baby continues to poop, even if there's the level of jaundice is going high, as long as the baby is pooping, bumababa at bumababa yung level ng jaundice. Now, the only way the baby poops, if the baby eat. Now, kung si baby mahina sa latching, mahina sa breastfeeding, the other option would be to supplement the baby kung walang gatas. If mom has no milk, is to supplement baby with formula, and then that would be help the baby to poop. Depends on your doctor's advice, kung anong advice ng doctor if there's not enough milk for mom. Most doctor would just say, give the formula, observe it for maybe 3 or 5 days, and then once the milk come in, then stop the formula. Ang ibang mga doktor naman sasabihin na, oh, continue the formula because the milk is not enough, breast milk is not enough para mawala yung breast jaundice ni baby. So again, depende sa mga doktor nyo, kung anong advice ng doktor nyo. I'm only giving here general information. This information may not apply to you, may not work for you. So it's always good to ask advice from your doctor. If you feel like ang jaundice level ng baby nyo, it's not working, and then your milk supply is low, so lalong magjo-jaundice yung baby. There's some moms who ask, what can jaundice can damage, or what side effect of this? Sometimes it can damage the baby's kidney, it can damage the baby's brain. Sometimes the baby gets severe seizure with a high level of jaundice based on study. So it's for some babies with high level of jaundice, it needs to be checked by your healthcare provider. Pag sa tingin nyo, let's say, buntis kayo ngayon, and then you have no clue about this jaundice na common pala sa mga Asian. So after you give birth, kahit ang dami mong gatas, jaundice pa rin si baby. Just observe the baby's behavior, okay? If the baby is feeding good and pooping good, kahit na jaundice, that will help, okay? Pero pag sa tingin nyo na grabe na yung, you know how can you tell when the jaundice is really severe? Normally, for a few days, let's say 3 to 5 days, start of jaundice level, normally, ito lang yung yellow, the face. This one here. Then it goes to the neck, and then it goes to the stomach, and then it goes to the legs. So pag nasa legs na, nasa extremities na, ibig sabihin, the jaundice is really higher. Okay? Pag dito lang, the cheek, the neck, the nose, the forehead, normally with frequent breastfeeding, normally bumababa na yan mga 1 day or 2 days after. Mawawala na yun. But if you feel like it's going down to the neck, to the body, to the extremities, then that's a concern. You need to see your healthcare provider. Now, going back to breastfeeding. If nanay wants to continue the breastfeeding, breast milk while the baby is feeling lazy, not latching, your only choice, there are 2 choices. Either you're gonna express your milk manually, whatever you can get, through a cup, through a glass, whatever, if you have no pump, or to pump your breast milk and give it to the baby by a spoon, by a cup, or by a bottle. If your baby already started with the bottle, never mind using other alternative feeding tools. Use the bottle. Mako-confuse lang si baby if you're gonna use the cup, you're gonna use the spoon. If you started with the bottle, use the bottle. Then less headache, okay? But if you haven't started the bottle and you want to use a cup or a spoon to feed your baby extra milk to prevent the jaundice, then use a cup. Kalimitan kasi nangyayari sa mga babies na nakapag-start na ng bottle sa hospital, sasabihin ng mga healthcare provider nyo, make sure give your baby your extra milk using a cup or a spoon or a syringe. If it's convenient for you, go for it, okay? If you're comfortable to do it, go for it. I have lots of videos about using alternative feeding tools. You can watch that, because that video would really help you on the type of options that you're going to be using if you want to supplement your baby with your own milk. However, if you're going to be using artificial milk to supplement your baby because you don't have enough milk, the baby is not latching, and if you can't afford to buy the formula, go for it, okay? Go for it. But make sure, ask your healthcare provider for the right option that you need to do. Either you're gonna do the powder, you're gonna do the concentrated one. Concentrated one is a little bit pricey, and the powder right now, artificial milk, they're very expensive because again, we have shortage, right? So everywhere in the world, we have shortage of breast milk or of artificial milk. There's also shortage of breast milk. There's not so many milk bank right now. They need more milk. So kung isa sa mga nanay who have so many milk right now, if you feel like you want to donate your milk, contact your milk bank, because there's so many babies right now who needs breast milk. The only thing that I'm gonna add to the problem with the latch, continue doing it when the baby is alert, okay? More skin to skin, remove the clothes if you can do it. If the baby is kind of sleepy, try to stimulate the baby, tickle the baby, starting from the forehead, the cheek, the neck, even the hands and the toes, feet. Tickle that para maging awake and alert si baby before you latch. Now the trick is, what my tip is when the mom is trying to latch this sleepy baby, massage your breast first for maybe 2 minutes so that the letdown is already triggered before you latch this baby. Because if the baby is latched there and the letdown is not triggered, the baby has to work hard to trigger it. Then the baby is just gonna fall asleep. So what you need to do is make sure you trigger the latch, that you trigger the letdown, massaging it for 2 minutes. Some moms, I advise them to put a warm towel in their breast for a minute or two. Put a warm towel. Once you put the warm towel there, because that triggers the letdown, right? Warm towel and then massage it. Then latch the sleepy baby, okay? That's one of my tricks that really work for the babies who are lazy, the baby who doesn't want to latch. Now make sure when you latch this baby, express a little bit of your milk, rub it, get that drop of milk, rub it around the baby's mouth, continue to rub it around the baby's mouth so that the baby will taste your milk. You can put your finger in there with the milk and let the baby suck, okay, to make sure, energize that baby, okay? Then when the baby tastes the flavor of your milk with the sucking, then switch it to the breast. You can do that 1,000,000 times, many times, if the baby still refuses to latch. Because that's one of the tricks that I use for the babies who are just lazy. I call them lazy feeders, weak feeders. Sometimes they just don't care, because especially if they started with the bote sa hospital. So start stimulating the baby and dressing, do skin to skin, tickle the baby, waking up the baby, and prepare this. Because by the time you latch and you're not prepared, then the baby just gonna fall asleep, okay? So I hope you learned something from this video. I would love to hear your comments, your questions, what topic you want me to discuss, either parenting, how to discipline your toddlers, anything that you want to ask me. Just do your comments, share this video, dahil alam kong ang daming mga nanay ngayon who are really struggling to latch the baby, to breastfeed their baby, or to formula feed their babies. I'm here to help and share the knowledge that I have. And please do like this video, share this video, and continue to subscribe. Dahil kayo lang yung mga supporters ko. Without you, hindi ko may pagpatuloy itong YouTube channel ko. Dahil nagre-rely ako sa mga comments nyo of how you like my videos, what topic you want me to discuss. So, kayo yung kung nangangailangan kayo ng tulong when you're pregnant, if you're pregnant right now, I'm here to provide, to guide you on how to successfully get that baby out of your womb healthy, with your healthy nutrition, healthy tips, breastfeeding tips, formula feeding tips, etc. Bye for now. More videos to come. Thanks for watching.